Okay, now we are going to start our class now. So this will be the first lecture on the OET writing. I will try to explain each and everything in detail. First of all, like we can see there, we have 45 minutes time in total. So out of that 45 minutes time, in the first 5 minutes, you are not allowed to write anything anywhere. This is just reading time. Then we have 40 minutes time to complete the writing task, right? So in that 40 minutes of your time, like you can see the letter and you can write it down. There will be only one profession specific task. Okay, there will be only one profession specific task. It means that you just used one task to complete your writing, right? It could be maybe, like we have different things such as your referral. These are different types of letter, right? We can see there. But the most common types of letter are these first three or the fourth one: the referral letter, the discharge letter, the transfer, and request letter. So following the layout of these letters, like it might not be that much of importance to understand the structure of these letters, but the most important thing for you will be, like the most important thing will be to understand the marking criteria. So what we have in the marking criteria is to see, first and foremost, is the purpose of writing. There is a commonly held belief among the candidates. They believe that, like the purpose of writing is your introduction. This is not the case that your introduction is your purpose of writing, right? This is not the case. So we have to see, like it's your whole letter. It's your focus of the writing task, right? It's your focus of the writing task. So, like you have to see that to whom we are writing this letter and for what we are writing and what is the issue. Accordingly, you have to organize the whole case notes into a letter format. So second thing is the content. Now content means selection of relevant case notes. Whatever you believe is relevant, you should write it down, and whatever you believe is irrelevant, you have to omit from here, right? Is it clear to you? Anyhow, so now what we have in the organization and layout, it's, you can see, like it's the sequencing of the information as per importance. So let's say, first of all, the first thing is to whom we are writing this letter, like who is the recipient. Where you can find this information, whenever you receive the case notes, you should go to the bottommost part of the writing task, and where you can see that who is the recipient to whom we are writing this letter. So where we can find this information, in the bottommost part of the case notes. I will display the case notes in a moment. This is the first thing that you have to see in the writing task, right? And secondly, what is the issue? So irrespective of writing task, either we are writing this letter to the, we can say, if it's a referral letter or if it's a discharge letter or whatever type of letter it would be, you have to see, like what is the issue. According to the issue, we have to organize the information. So let's, for the sake of understanding, I just have mentioned few of the things in under the title of the issue, which includes either it's a referral letter. For example, in the referral letter, if we had made the diagnosis of myocardial infarction, maybe an urgent referral letter, or maybe it's simple diabetes mellitus, or you are suspecting inflammatory bowel disease, right? Or inflammatory bowel syndrome, maybe. So these are the category of referral letter. Although we would discuss the different type of referral letter in tomorrow's class in detail, but to just give you insight about the purpose of writing, mean that your reason of writing has to be clear in the introduction, and your letter should be organized, or your letter should be structured or sequenced as per the importance of this issue, right? Similarly, in case of discharge letter, we do have, like different format of writing the case notes. In case if it's a discharge letter, like we do have a different format. Okay, let's say, like if you can see, in case of discharge letter, we have different things. If we are writing this letter of discharge for the recipient, and the main concern would be, for the compliance of the discharge plan. So accordingly, you have to organize the information. So that is the issue. So main thing, in the letter of discharge would be, uh, you know, it's your compliance of the discharge plan. Less rest of the details are don't that much important. So transfer letter is as simple as your referral letter, but there is a maybe a lower hierarchy to higher hierarchy transfer. There is let's say you can say from ward to emergency transfer, from emergency to back to ward transfer, maybe to the to the palliative care. For example, you're writing this letter of transfer to the hospice care. For the quarantine is kind of transfer letter we can expect in the writing. Request letters specifically, it's less likely in OET, either it's medicine or nursing, but we can expect this letter in a request letter, we'll be writing to the occupational therapist maybe. You're requesting occupational therapist to conduct workplace assessment. It's also a kind of request letter. You are writing this letter to a social worker to help the patient to resume his normal life. So these are different issues that can be categorized under the heading or the definition of your purpose of writing, right? That can be categorized under the definition of purpose of writing. Anyhow, so afterward, we can see that we have the content. Content mean you have selection of the relevant case notes. So relevant with reference to whom? Again, for recipient and for the issue. But in simple word, the thing should be relevant for the issue. So issue could be referral, issue could be discharge, and so on. So we need not to write down irrelevant history. It's a frequently asked question by the candidates, like if we are running out of words, should we include certain thing that is not relevant to the issue? So to answer this question is simply no, because the selection of the case notes is also an important criteria. The first three criteria, which includes your purpose of writing, which include your selection of case notes, and which includes, your organization and conciseness. Sorry, fourth one, they are critical in view of, we can say making it pass or fail. So do not add anything that is irrelevant as you are being tested on that. And semi-relevant information is optional. So let's say semi-relevant in one category is that it might be relevant for the recipient, but for not the issue, right? For example, if we have a patient who has, who we are referring to the surgeon for right knee replacement surgery, and the patient has a past history of appendectomy, you can see it has no relationship with the current issue, but it might be relevant for the surgeon due to the fact that he has a past history of surgery. So, it's something that we can say is semi-relevant information. We can omit and we can join. It's your call, right? Anyhow, so the third criteria is your, you can say organization and layout. Organization cannot be defined in detail because it's more of practical thing. It's more of the thing that you have to practical on your ground. For example, we have to sequence the information as per importance. If you believe that the information that you have is appropriate to write it down in the sequence of your letter, then your organization will be appropriate. How can we define this if this sequence is appropriate? There is no standard structure, as most of the people, they are practicing structure from the internet, and they believe that okay, in the introduction we should write down blah blah thing, then second paragraph we can write down the social plus past medical history in case of referral letter, and in the treatment record we can write down the summary of this thing, and then it can be applicable to few letters but not to all of the letters, so that you should be judicious in organization of the case note. That's why we won't encourage you to practice any of the you can say conventional format, right? You should not practice any of the conventional format. You must be open, or you have to have a flexibility in your format if you are having any. Let's say if you have created your own format for your ease, that I would be having maybe 5 to 6 format in writing different types of letter. So you should not be rigid in your format. You must have flexibility to change the sequence of the information as per the relevance, right? The last thing in the, organization and layout is the structuring. of where to write down the date and how to write down the address, either to use punctuation, full stop or not, structuring of the paragraph. This come under the layout part, right? Now moving on toward the next criteria, the fourth one is also an important criteria, is your conciseness and clarity. So conciseness, as the name indicate, is the summary skill. It's it's not the case that you would summarize whatever you see in the letter. You have to summarize only relevant but less relevant detail. If we can see, we have a lot of multiple visits, and you can see there are the things that are happening in repetition. So in that regard, you can write it down. You can summarize the less relevant detail. It's not the irrelevant that you have to summarize. It's the relevant, but that has not been categorized as more relevant. For example, if we have 3 visits in case of referral letter, or 4 visits, maybe the patient is having, uh, let's say, repetition of event. Let's say mild chest pain. He presented to us thrice with the same thing, and there was nothing significant, but a lot of information in these 3 visits. And the last visit, we do have less information, but very significant information, such as testing chest pain, such as ECG finding, and so on. So the last details should be expanded, and the first few visits should be summarized, right? Anyhow, similarly, in the letter of discharge, you can see that you can find a lot of information in the ward stay. So the ward stay might not be that much significance, like to write it down, as I've seen that people try to follow the sequence of the information given in the case notes. It is imperative for you to understand that sequence of the information given in the case notes might not be that much important. It has to be kept in your mind that you need to organize as per importance. As per importance, you need to be organize the information, right? So similarly, as you can see there, uh, you know, ward details and the rehabilitation should be summarized, and the discharge plan should be expanded. So these are few of the example that we have discussed for the conciseness. And clarity mean bringing the same information together. It should not be vague, because sequence of the information given in the case notes might not be the right sequence. You have to sequence yourself. Now, second last criteria is the genre and style. Now, genre mean that your language should be technical. You should not be using the non-technical words. In case of vocabulary, for example, these are few example. If you are writing in between the profession, mean doctors writing to doctor, nurses writing to nurses. So we have to see according to the audience or the recipient, we need to change the form. Let's say shortness of breath can be written as dyspnea, tiredness to lethargy, hearing voices to hallucination, and so on, right? Never use the acronyms. For example, they may have written like 2 by 52, it's mean 2 weeks, 2 by 24 mean 2 hours, 3 by 7 mean 3 days, and let's say accordingly we can choose. Let's say 2 by 12 mean 2 months, and similarly abbreviation. Let's say FB, E, and so on. Full blood examination. You should be judicious in the use of abbreviation. You should not over or underuse the abbreviation in your letter. And try to use your own language by transforming them, by transforming the case notes. Do not use the same word that has been given into the case note, but be critical while transforming. Make sure that you will not change the meaning. Now, coming to the next part, that is your language. Now, what we have in the language part? In the language part, you have to learn that which tense is more appropriate and which tense is less appropriate, right? If you can see there, you can see that uh, I have to use maybe present tense, I have to use maybe past tense, okay? Or I have to use maybe perfect tense, okay? So basically, as per the importance of the tense, as per the importance of the events, I need to select the right tense. Our case notes will dictate you like when you have to use past simple tense and when you have to use the past perfect. Because we have seen sometime candidates have been using, like same form of the tense, let's say past simple, for both of the events that can be segregated with reference to the, like grammatical structure. One event should be written in the past simple and other event should be written in the past perfect. Similarly, range of sentences which include simple, compound, complex sentences. In the complex sentences, we have to add the clauses such as clause of purpose, clause of reason, clause of time, and so on, and active to passive transformation, and so on. So this is the marking criteria. As per standard, we have to write it down. Now I can see that you can see my screen. Yeah. Okay, if you can see the screen, let's say whenever we got the case notes, you should go them to this point. This is the last part of the letter. And here, what we can see there, that just read this part. And just read this part first. Here you can see there that most important thing is to whom we are writing this letter. And we can just find this. This is the writer of writing to the palliative care. So the first thing that we have discussed is to whom we are writing this letter. This is the first thing. And what is the reason of writing? And we can also find that particular reason of writing in here for further care and assistance of this patient. It's understood from this writing case notes that we are writing this letter to the palliative care nurse, obviously for the palliation, right? Anyhow, so now we can start reading the case note from top to bottom. But before that, you can see there we have a terminal cancer. This is provisional diagnosis, and patient want to spend last days with a family member. And just have a quick bird eye view. When we see these notes in discharge plan, what we have, this pressure point care, okay, we have dietary instruction, we have psychological support, and postural care. So these things will give you the focus of this task. Anyhow, so now from top to bottom, we'll start reading the case notes. Here you can see there the name of the patient. Fine, we can see date of birth. We will incorporate in the layout part where we write down the address. Height and weight can be written. Specifically, the BMI is important. Now this is the date. It's the today's date. Here there is no other date. In this letter is the today's date. And one of the most frequently asked question, normally candidates do ask, like, where to write it down, the today's date, and like which date should be written as the today's date. So as a matter of fact, it is important for you to understand from the last maybe 5 to 6 exam, they do mention over here, assume today's date to be this one. Previously, we used to have the exam date to be as a today's date, but now for the last few exam, like they are mentioning assume today's date to be. Anyhow, so moving on toward this thing, you can see social history. Retired teacher lives with her husband in Coburg is relevant. I will not ask. I'll tell you why. Because of the, we can say, psychological support. For the psychological support to the patient and family, it's important to know. The nurse should know that what is the profession of the person. It's indicating sedentary lifestyle at the same time, and number of family members that has been living with the patient. Number one. Number second reason is whenever we have a home visit, whenever we have the home visit, we should incorporate these details, including the personal history as well, right? Okay. So we can see non-smoker and no drinker, they can be semi-relevant. You can omit them because it's important negative, not that much important to be written. In the last stage of cancer, it's not that much significant to incorporate these 3 points. No, allergic to seafood, yes, it's important because we had seen there was the plan for the diet, for example. That's why we will mention this thing. Now coming toward the patient family history. If you can see there, in case of family history, we will see that we have the mother history of diabetes, then hyperglycemia, hypertension, heart attack, diabetes again, okay, whatever. And but right now, as we can see, always see the issue. The issue is the provision of palliative care services. So the patient is at terminal stage of cancer. So these details are not relevant to be written. It's totally irrelevant. So we can omit simply. We can simply omit these details, right? Okay, we'll see the question. So basically, now we can move on and see the further details, such as childhood chickenpox, it's not relevant. Mumps, not relevant. Diabetes, yes, it's very relevant. So diagnosed with left breast cancer, there's a possibility that in the real exam, you may get this information that is being compiled on one complete page to make you confuse. So we can just summarize this thing down in one word is the metastatic stage of cancer, or this word only. No need to mention about the radiotherapy, mastectomy, or when she was diagnosed with left breast cancer. If we are writing to the palliative care nurse for the provision of palliation, just specific to this case, this selection might not be applicable to all of other, like cancer cases. I'm just concise about this specific letter. I'm just be talking about, like this specific letter when we are writing this letter to the palliative care nurse, right? Anyhow, so to move on, we have a question. No, sorry, I'll repeat this thing for you. Basically, we can see there, we just have to summarize these details. In the exam, if you got this case notes, the history will be compiled on, like one complete page. But we just have to write it down, the met stage of cancer over here. No need to mention that when she was diagnosed and what about the radiotherapy and mastectomy. It's just specific to the selection of this case notes. It might not be applicable to if you are writing this letter to the oncologist. We are writing this letter to the palliative care nurse, and we are writing to request for the provision of palliative care services. In regard to this selection, it might not be important to write it down all the details, but just the summary. But here, the discharge plan should be, we can say, incorporated. You should not miss anything. And here is the time when you have to organize and when you have to, we can say, expand the case notes, right? Anyhow, so now we'll be discussing and we will try to write down this complete letter in the class now for your understanding. And yes, we will discuss about how to transform the case notes as per the question that is being asked. So now we can see the bottommost part. We can write down the date over here first of all, or maybe the date can be written at the end. Now there is a confusion among the candidates. They will always ask that how can we write down the date? Either first is to write in American format or British format. I will say that just follow one format. Either you want to write in American, so follow all the dates in the American format. And if you're writing the British format, follow all the letter in the British format. But British is more, like appreciated. Anyhow, secondly, how to write down the date. For example, in this case, we have the date 707, let's say 04, that is being given date, and 2018. In the top left corner page of your sheet, you can write down this date, leaving the first tab of the page, just write down this date. Or it can also be written in this way, like we can see in 7/4/2018. It's also appreciable. You can write it down, or you can also write it down the date in this format, 7th, maybe April, 2018, if in British format. Anyhow, so all of the formats are acceptable. So let's say I just use this one now because I have to change the format of the date as per the given history, but those formats are acceptable. Then leaving one line. Afterward, you have to leave one line and you can write it down the name if the name is being given. In this case, you can see that the name is not being given, right? In this case, you can see that name is not being given. You can see there, we have to see that this is letter. Obviously, I have to relook for that if we have any mistake over there with reference to grammar or not. So now we can see, like we have the date format, the address format, there is no comma. We can write down regarding over here, the name of the patient, date of birth or age. We can put space over here. And dear nurse can be written above and below as well. We can say have one space between each line. Then you can see that we have to and write down the introduction. Okay, Ms. Harley, who would require the provision of palliative care services. Okay, we can see that both of the things has been addressed. request of palliative care services, and the patient terminal stage of cancer. Better to start from the main issue, that to need to pay a home visit for the you can say for the provision or for the care of bed sores. I have discussed everything in detail regarding that. Then about the sponge bath has already been discussed. Then for the pain, we have to add the morphine. Secondly, for the diet, these are the dietary instruction that has been given to you. You can see this can also be written. She has been diabetic and also in this language as well. Then socioeconomic details. You can say we have to write it down. The socioeconomic details together with the psychological support and then religious aspect. And then we have to close the letter, right? In this way, we have to close the letter. Okay. So if you have any further queries, we can write it down. Then yours faithfully leave 1 or 2 lines and doctor or nurse, right?